What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge.
My name is Alade Tayo. I'm the MD CEO Imperial Healthcare. I strongly recommend that you watch Exposé with Reverend Tony Akinyemi every Monday at 8 p.m. Nigerian time. I'm sure you'll be greatly blessed as you do so.
Hello and welcome to Exposé, your Monday tonic. I'm your regular host, Tony Akinyemi. For the months of May and June 2021, we've been looking at medical systems. I introduced several of these medical systems in the first two episodes in this series. We briefly mentioned the medical systems like osteopathy, allopathy, homeopathy, naturopathy, chiropractic medicine, and integrative and functional medicine. And I promised after those two episodes that we will be bringing experts from around the world who are practitioners in these various medical systems. We were blessed with Dr. John Tor in the last two episodes, who spoke extensively on functional medicine and integrative medicine. Today, we are honored to have another big fish in the house, a juggernaut in the field. He will be introducing himself so we get to meet him properly. But let me just give you this heads up. I met him a couple of years ago. I was in his clinic to find out one or two things about what he does and to also take advantage of some of the protocols that he has available in his clinic. And there are two doctors I have met in my life who are never in a hurry. They take their time to meticulously answer your questions and ask questions. And the time they dedicate to their patients, to listen to their patients and gather information and, be able to come to that point where they can proffer solutions to whatever challenges those patients are facing. There are two doctors that I have met with almost inexhaustible patients. And Dr. Abayomi Aiyesimoju happens to be one of the two. He's a consultant neurologist who has practiced outside Nigeria and within Nigeria, and who is also a practitioner in homeopathic medicine. I'll let him introduce himself to us, and then we're going to be asking him questions about homeopathy in particular. We will spare him of neurology today, but we will go on to homeopathy, and he will give us practical insights into homeopathy and how each and every one of us can take advantage of the options available to us in homeopathy. Don't forget, we always say what we need is not more medication, but more education. Because what you don't know, you don't know. And when you are informed, then you can be transformed. But when you are uninformed, you are actually deformed. So information is key and powerful. And when information becomes available to us, then our options are many, and we can prayerfully consider which options would be best for us. And that's why we are bringing all of these juggernauts to come and talk to us. We are so glad to have you here today, sir.
Thank you.
It's an honor to be able to bring a personality like you.
Thank you very much.
We would like, by starting with you, to let us know who is Dr. Abayomi Aiyesimoju. I hope I pronounced the surname correctly.
You are doing very well.
Thank you, sir.
Yes. Thank you very much. As Pastor Akinyemi has said, I'm a neurologist. I was, in fact, consultant neurologist at the then General Hospital Ikeja, which has now become LASUTH. And I was there from 1984, when I left UCH Ibadan to get a consultant post at the then General Hospital. And I worked there as consultant neurologist until 1986, when, for personal reasons, I needed to leave paid employment. I formed my own clinic, the Healthville Clinic, and continued to practice as an orthodox physician in that clinic. And that went on until the early 90s, when we were visited by a friend of ours working in the United States. She herself, being a board-certified pediatrician, told me she has stopped practicing orthodox medicine and that she was now into homeopathy. I said, what? Tell me more about homeopathy. And the way she spoke about homeopathy was so glowing that immediately I made up my mind that I would learn more about this field of medicine. Fortunately, I was about to travel then, so I put into my plan to visit her in San Francisco,
right,
as a pupil.
Right.
And I was following her from patient to patient in the clinic for some time, trying to get a hang of homeopathy, about all the books that I could possibly lay my hands on, and then formally registered with the British Institute of Homeopathy to learn homeopathy as a student, and I became a fellow of the British Institute of Homeopathy. Since then, homeopathy has been the mainstay of my approach to the treatment of patients and management of my clients. And it's not surprising that Pastor said that he found me very patient coming to see me. You cannot practice homeopathy without being patient. That is one of the key features of the approach in homeopathy, which of course we shall hear more about in the course of the program.
Thank you very much for that elaborate introduction. I was actually going to ask you a question. How did you cross from conventional medical practice into homeopathy? But you already answered that, so that makes it good. But I will also want to probe a little bit into your background in conventional medicine. You mentioned UCH, you mentioned General Hospital Ikeja, which is now LASUTH, Lagos State University Teaching Hospital, where you had served as consultant neurologist. Where else have you practiced your trade, whether in conventional or in homeopathy, within and outside of the country?
Thank you. As part of my postgraduate training in neurology, I was at the Montreal Neurological Center or Institute.
That's in Canada?
In Canada, where I learned and also practiced. And over the years, I've had connections with London, where I have some friends also practicing complementary alternative medicine, and with whom I've had a good fortune of working from time to time. These days, the world has become an open space. You can help people from all over the world by working online. And so there's no limit to where we now have the opportunity of helping people from different parts of the world.
Thank you, sir. I'll ask one more about your background before we move into homeopathy itself.
Yes.
I think I listened to one of your presentations on Zoom. I joined the Zoom class where you made that presentation. Maybe you were not aware, but I joined that Zoom presentation. I think Mr. Yorowolo organized it, right?
That is correct.
Right. So I heard you say that you have delivered, lectures and trained, doctors and different places. Where on which platforms have you made presentations, either on homeopathy or neurology?
Okay. Now, as far as training people in homeopathy and neurology, it is essentially in Nigeria that I've had the opportunity of doing that in neurology. However, I've also been privileged to speak publicly on health matters.
Right.
Sometimes in America, and I also speak on matters concerning human well-being on so many platforms. I even write on these matters. And it may also interest you to know that even in the field of neurology, my focus changed over the years, in the sense that I was no longer looking at the brain just from the point of view of disease.
Right.
I was now looking at the brain as an instrument.
Okay.
And trying to understand it as such. And now equipping myself with knowledge and skills to help people optimize their brains.
I remember that when I came to your clinic, you did mention that.
So I do brain optimization at the individual level. I coach people. I train companies in brain optimization. And in this connection, talking about where I've worked, I have worked even at the headquarters of the World Bank in Washington, where I've had the privilege of training some of their staff.
Wow. Excellent. Brain optimization.
Yes.
So it's not just about looking at afflictions of the brain, but looking at the potentials.
Optimizing the potential.
Optimizing the potentials of the brain. And that reminds me of something else I picked in the last Zoom presentation you did. You mentioned then that you bought books and studied and learned a particular language all by yourself. Maybe you need to talk to us so that can link with the brain optimization thing you're talking about.
Well, that is true. That is true. These things are all interconnected. First of all, I chose to learn German language.
Okay.
And as things would have it, I was able to do this on my own.
Okay.
Just by buying the book, German in 20 lessons.
And learning German all by yourself.
Myself.
So you speak German right now?
I do speak German.
Oh, wow.
And again, along that line, I felt there was need for me to understand French. And I then took up French in the same way that I took up German. And I also speak French today. So you can see what advantage it was for me when I went to Montreal.
Right.
Which is a French-speaking
region of Canada.
Of Canada. And the advantage that it has been for me to speak French as the district director of Toastmasters in West Africa, covering 14 countries, where most of them speak French.
Francophone. Right.
So you can imagine the advantage that has been.
What's Toastmaster?
Toastmasters is the world's leading organization of a non-profit nature devoted to the development of human ability to communicate and to lead. Leadership and communication.
Wow.
That is what Toastmasters is all about. So these things are all connected. Of course, in the course of learning these languages, as anybody who knows about the brain would tell you, my brain had to change.
Right. Reconfigured.
As I acquired all these skills. And that is what happens with all of us.
Praise God. Isn't that wonderful? I mean, so I'm sitting right next to a genius. I'm so honored. Thank you very much. We're going to take a break at this point. We've learned so much about who Dr. Abayomi Aiyesimoju is and a bit of his background. I know if we wanted to talk about his background, the whole episode would not be sufficient, but I think we've gathered enough information about his background. And so in the second half, after this break, we'll be delving now, digging deep into homeopathy proper. Don't go away.
I believe you've been having a terrific time with me on Exposé with Tony Akinyemi. We have great resources that will bless your life available to you on healthy living and many other life subjects. We have various platforms where you can obtain material for your blessing. You can obtain some of our work, our books, particularly on Amazon.com. How to Regain and Retain Your Health is a book title that I highly recommend. It's available in digital format, Kindle edition, as well as in printed version. We also have juices and smoothies for healing, health, and pleasure. You can also find these items at another website, familabooks.com, F-A-M-I-L-A books.com. And for those of you who are in Nigeria, you can reach us at the Shepherd Store, 18 Shogunle Street, off Mobolaji Bankantoni Way, behind HFS Place, to get our materials. We have over 600 recorded audio CDs, DVDs, VCDs, and MP3s on various subjects. All these things that I teach on Exposé are already available in their complete format. How to reverse hypertension naturally, how to reverse diabetes naturally, how to reverse arthritis naturally, and many other wonderful titles. I encourage you to visit this website, Amazon.com, familabooks.com, or CSS bookstores in Ikeja, Lagos, Nigeria, and you will be blessed reading those materials and sharing them with your friends and family. Thank you once again. God bless you.
Welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church, and I'm your regular host, Tony Akinyemi. We are dealing with medical systems, homeopathy, osteopathy, allopathy, naturopathy, chiropractic medicine, functional medicine, integrative medicine, and all the different modalities outside of mainstream medicine. And we are interviewing experts in the various medical systems. We've had the privilege of hosting an integrative practitioner. Today, we are honored to have in the house Dr. Abayomi Aiyesimoju, who is a consultant neurologist as well as a homeopathic doctor who has practiced within and outside Nigeria and is currently practicing in Ikeja, Lagos, Nigeria. Of course, because of technology, the whole world is now a global village. So he also consults with people around the world. Maybe they call that telemedicine right now. So he's available to everyone around the globe, not just within Nigeria. And as you can see on his face, you will struggle to guess his age. He's looking much younger than his age, I can tell you. And that means that what he's practicing is really working for him. And we thank God for your life, sir. Once again, we welcome you to Exposé.
Thank you.
And we are honored for the privilege of granting us this opportunity to interview you.
It's a pleasure.
Now, in the first half, we got to meet Dr. Aiyesimoju. In this second half, I want to ask some questions regarding homeopathy. Now, I want to start with this first question. Some of our viewers don't even know what homeopathy is all about. They're wondering, is that a special Japanese dish or Chinese dish, or what exactly is this homeopathy they are talking about? So what is homeopathy?
Thank you very much. Indeed, people will not have any idea what homeopathy is just by hearing the name. But put very simply, homeopathy is a system of medical practice based on the principle that like cures like. Like cures like. And what do I mean by this? It is best if I would explain this by telling you the history of how homeopathy came about and was discovered by a physician himself, Hahnemann, Samuel Hahnemann of Germany, over 200 years ago.
Wow, such a long time.
Yes. This man was so dissatisfied with the way medicine was being practiced in those days, using bloodletting, using leeches,
right,
using purgation, emetics, very many crude and invasive methods. He was so frustrated that he gave up the idea of practicing medicine and started translating and doing research for a living. And then he put himself on the bark of the Kinkona tree, which is where you get quinine from.
Right.
And as he was taking the bark of this tree, he observed in himself that he was now having intermittent fever, which is the pattern of fever that you have in malaria.
Right.
And then the idea struck him. Is it possible that the very thing that you cure malaria with, if you took it without having malaria,
you produce
it could give you the same symptoms?
Right.
He started to pursue that idea of like curing like.
The principle of similarity.
Similarities.
Right.
Yes. So he then started testing himself profusely, testing volunteers profusely, and documenting his findings. And this was the way the field of homeopathy was born, and it's been continued since then. And through the documentations of findings in people of substances that give rise to certain symptoms in the healthy person being the same ones that are used to cure those who come with those same set of symptoms without prior exposure to the substance. The whole field has now gone all over the world. There are thousands and thousands of homeopathic remedies which the homeopath can use based on the findings he sees in the patient that presents to him. And then very quickly, let me just add that Hahnemann soon discovered that when he diluted these remedies and also potentized them by shaking them vigorously, the more he diluted and shook vigorously, the more potent.
Is that what they call the principle of potentiation?
Potentization
or dynamization?
Or dynamization.
Right.
Yes.
See, I have studied a bit of homeopathy.
Yes. The more potent the remedies became.
Right.
And what was even so amazing was that you would dilute the substance to the extent that scientifically there's no longer one single molecule
to trace in the remedy.
And yet its potency remains and will continue to increase as long as you dilute and succors.
Right.
And this could be a convenient point to also mention that these remedies that this man discovered, they act upon the entire human being.
Right.
All of them. Mentally, emotionally, and physically. And so in their very nature of acting, they are holistic.
Right.
That, I think, is what I want to say about telling the audience what homeopathy is.
That's wonderful, wonderful. That would mean then that the the level of toxicity that may be present in remedies, as far as homeopathic remedies are concerned, will be almost non-existent.
In fact, that is one of the strongest points of homeopathy, apart from other points which we can mention later. Talking about side effects,
right,
this is hardly existent. And in fact, when you reason, you'll find that on the basis of homeopathy, those things you call side effects
right,
in allopathic medicine,
right,
you call them side effects,
right,
but they are actually effects of the medicine. It's just that they're not the ones you want them to have.
Right.
And on the basis of that, you can even now develop homeopathic medicines,
right,
based on the so-called side effects.
Right.
For example, if a person takes a drug and comes down with a bad side effect of it, you know that you can then take that same drug,
right,
and convert it into a homeopathic
remedy
and give it to this very person,
right,
who is suffering from severe side effects of this drug.
And that will remedy
that
the
will
side
then
effects.
help, yes.
Right.
Yes.
Good. So what Dr. Aiyesimoju has told us today is basically the principle of similarities, the principle of dynamization. In other words, if a well person were to be given a remedy, and that remedy produces similar symptoms as the disease that remedy is to be used to treat, that is the principle of similarity. And then the remedies are so diluted and diluted and diluted that what you have in the remedy is not necessarily chemical active ingredients, but probably the energy
absolutely
of the remedy, and that works on the entire system, not just on a particular system or organ or tissue, but the entire body, and that makes it holistic.
That is what makes it
and
holistic.
That also means that there is little to no negative effects or adverse reactions from homeopathic remedy. That's about the summary of what we have gleaned from him right now. I think you've already touched on the next question I wanted to ask, except you have further explanations to give on how does homeopathy work? How does it work?
Oh, well, exactly. We've touched upon that already. But let me just quickly add that the energy pattern that is the active essence of the homeopathic remedy, it doesn't work directly on the tissues or on the chemistry of the body. It works with the body's own innate healing forces.
All right.
It acts as an ally to the healing forces to help them achieve what they would normally want to achieve, because the body is never inert. If anything happens to the body by way of destabilization,
right,
the forces get to work.
Right.
So you have these remedies can now come together with those forces and help those healing forces achieve their purpose.
Right.
And that's why you'll find that homeopathic remedies, they work from within out. You start feeling better mentally and emotionally, even when the physical symptoms are still there.
Right.
And they also work from above downwards, incidentally.
Right.
If you have a rash all over your body, the parts of the body that are higher will be clearing, and the last part will be the limbs. The limbs, as if it's being pushed
top-down
out
approach.
of the body.
Right.
And priority is always given to the vital organs in the body. It is the peripheral organs like the skin, the air passages that will bear the brunt. That's why many a disease you have rashes
on the
coming
skin,
out. That is a way of helping with the detoxification, either through what's happening on the skin or through the phlegm that you are producing, or through the diarrhea that you are having.
Right.
That is the way homeopathy works.
Thank you, sir. Thank you so much, sir. Well, obviously, from the way things are going, we are going to have a part 2 because we cannot cover all the questions in this first part, but it's a very beautiful place to start from. I want to also ask, what kinds of conditions, what kinds of health challenges, diseases, maladies, afflictions, that homeopathy can be of help to? For example, mental health conditions, chronic degenerative diseases. I'm thinking in terms of, for example, somebody with generalized anxiety disorder, or somebody with Parkinson's, or somebody with diabetes, or somebody with cancer, or somebody with are there conditions that homeopathy will not be really helpful for, and others that, these are the ones that homeopathy will really help? Or does it cut across every area?
Indeed, put simply, there is hardly any kind of ailment where homeopathy will not be of help, if only as an adjunct to other forms of treatment.
Right.
People will be asking, what if somebody needs surgery? Homeopathy will not repair a broken leg.
Right.
No. But homeopathy can shorten the time of healing.
All right.
Not only of the muscles, but also of the bone.
Right.
And if you have delayed healing that is not just happening the way you want it, homeopathy is able to strengthen your healing forces to bring about that kind of healing.
Right.
You talk about trauma, physical trauma.
Right.
There's no physical trauma without some degree of mental trauma.
Right.
Homeopathy is excellent in that respect, apart from that, the fact that you even have remedies in homeopathy that are known to really help in the physical sense whenever there is trauma. So to make it brief, there's no aspect of medical practice where homeopathy cannot be of some use, if only as an adjunct to other measures.
Good. That brings us to the dimension of integrative medicine.
Exactly.
Because one of the things I have personally observed, and I do believe that many people out there can attest to it, is that in the various medical systems, in the attempt of the practitioners to help their patients and their clients, there tend to be this rivalry and this attempt to protect one's turf. Everybody wants to protect their turf, and everybody wants to put themselves forward as we are the mainstream, we are the main line. All others are just trying to catch up with us, or all others are quacks, I've talked to some conventional medical practitioners mentioning some protocols in alternative medicine, if they were aware of them, and they would tell me, if anything is out there that needs to be known, we will be the first to know. And if we don't know, it means it doesn't exist. I've met people who talk that way. Wow. But you are talking about, integrating what is available in conventional medicine, allopathic medicine, with what is available in homeopathy to get a better outcome.
Yes.
To integrate, which is what I call getting the best of two worlds.
Exactly.
So what you're saying in effect is that homeopathy is not contraindicated for allopathy or vice versa. They can actually be integrated and they can work together well.
That's why you speak of complementary alternative medicine.
Right.
Complementary in that various modalities from various systems can be used together.
Right.
In a way that one complements the other.
Right. Great. We will have to stop here because I have received signals that our time is up. But next week, by the grace of God, we will bring back Dr. Abayomi Aiyesimoju to continue this conversation on homeopathy. And I will also be asking him some straight questions regarding his practice, because I have been to his clinic in Ikeja, Lagos. I have undertaken colonic irrigation there, and I have also used some of his homeopathic remedies, and I'm going to be asking him specific questions. But so that those who are with us today may not miss out, I would like us to just drop a bit of your contact. How can people contact you, even if it's just your website or an email address or a telephone number, whichever one is convenient?
Yes. We actually have a clinic manager who can be reached on the number 080-230-5400. That's both WhatsApp and the regular mobile number.
Voice call.
That's the contact that we have.
If you can say it one more time so that our technical guys can put it on the screen.
Yes. 080-230-54070. Both voice call and WhatsApp.
And your clinic is located in
89 Adeni Jones Avenue, Ikeja, right next to the Lagoon Hospital there.
Lagos State, Nigeria.
Yes.
And
exactly.
for those who are outside Nigeria, because we have quite a number of our viewers outside Nigeria,
yes,
you can also reach him by WhatsApp or by telephone contact.
Yes.
And these days there is teleconsultation.
Yeah, exactly.
So that can happen. Once again, we'd like to say a big thank you, sir, for finding time to be with us today. We truly appreciate it.
It's a pleasure.
And I'd like to thank you also for being with us, our viewers, today. This has been Exposé, brought to you by the Shepherd's Flock International Church. And don't forget our axiom. What we need is not more medication, but more education. And the best prescription is knowledge. What you don't know may be killing you. In fact, the Bible says, my people are destroyed for lack of knowledge. You will know the truth, and the truth will set you free. And we thank you for spending your evening with us. We look forward to meeting you again next Monday, 8 p.m. Nigerian time, on Instagram, Facebook, and YouTube simultaneously. And in case you have not yet followed us on Instagram, please do so. And we'd like you to like us on Facebook. I tell people, even if you don't like my face, at least like me on Facebook. Isn't that wonderful? And then for YouTube viewers, I encourage you to press the subscribe button and the notification bell so that whenever we come live, your device will notify you so you don't miss any other episode. And by the way, all our past episodes are also in the archives on YouTube. You can go to YouTube and in the search engine, you can just put there Tony Akinyemi or Exposé with Tony Akinyemi, and that will bring out several past episodes and you can watch them over and over and over again. Also tell your friends to subscribe to our YouTube channel and join us every Monday at 8 p.m. on Exposé with Tony Akinyemi. Thank you and have a very pleasant and wonderful evening. God bless you and bye-bye.
I am Dr. Abayomi Aiyesimoju, a neurologist and a homeopath. I would encourage you all to watch Exposé with Dr. Akinyemi on Mondays at 8 p.m. You will find it very informative and you will take away from it a lot of knowledge which you can use for the improvement of your health.